In our review of the major diagnoses for admission to hospice care, we finally come to our last diagnosis, and that would be renal disease. When you are admitted to hospice with a diagnosis of renal or kidney disease, these points must be present. The patient is not seeking dialysis, or dialysis is currently being discontinued. The patient must not be on the transport list. One of these blood work values should be present: a serum creatinine greater than 8 milligrams, a creatinine clearance level of less than 10 without comorbid conditions, or a creatinine clearance level of greater than 15 with comorbid conditions such as CHF. The patient should be showing some signs and symptoms, perhaps uremia, which may include fatigue, nausea, loss of appetite, a metallic taste in the mouth, any mental confusion, oliguria with less than 400 cc's of urine in 24 hours, a potassium level greater than 7, pericarditis, and possibly an intractable fluid overload. Remember, renal disease will affect all of the major organ systems, so you may observe that the patient neurologically is very lethargic, they're minimally responsive, or they may be very restless and agitated. These symptoms generally will all advance as the patient has discontinued dialysis. The debilitated cardiovascular system may cause the patient to have angina symptoms that are unrelieved by nitroglycerin that require narcotics. The pulses may be very weak and irregular. In the pulmonary system, respirations become shallow and maybe rapid, greater than 60. O2 sats drop below 90, and there may be diffuse crackles to rales in all the lobes. Related GI changes include the stopping of ingested food or fluid. They may require antiemetics to control nausea and vomiting. The skin is expected to be thin, fragile, hyperpigmented. You may see uremic frost, which is actually crystals of urea deposits on the skin. Document the systemic changes clearly in your narrative notes. That's it for renal disease, and the last in the series of the review of Medicare criteria for hospice admission. Let's summarize in the last short video. And remember, visit our YouTube channel, The Hospice Care Plan. We teach you how to manage all the major symptoms and the needed care to provide comfort for your patients. Get your booklet and a crash course in hospice care at thehospicecareplan.com. And remember our motto: care is treatment.